Hey guys, it's Delicia, Cigar Vixen, and today I'd like to talk to you about a very important issue, our cigar rights. Now, those of you who follow the industry may or may not be aware of what the FDA has proposed and what is pretty much about to happen. Now, back in April, the FDA proposed a document that, in a nutshell, would be placing the same restrictions that are currently in place on cigarettes onto all other tobacco products, including premium cigars. Now, they did propose two different options. And the good news is that the FDA is actually asking all of us to comment and enlighten, some of these decisions that they're making. So, that being said, if option one were to pass, it would drastically change our industry as we know it. Take a look at option one.
Option 1 would apply to all products meeting the statutory definition of tobacco product. Example, any product made or derived from tobacco that is not a drug, device, or combination product, except for accessories of deemed tobacco products. Examples, hookah, e-cigarettes, cigars, pipe tobacco, novel tobacco products, and tobacco products that may be developed in the future. Here are some important bullet points regarding option 1. FDA would require approval and disclosure on all products released after February 15, 2007, meaning all manufacturers would have 2 years to disclose ingredients and submit application for each product, which will be reviewed by FDA and either approved or rejected. There are over 10,000 cigars sold in the market, some of which fall into the grandfathered category prior to February 15, 2007, but many do not. How the FDA is planning on managing all the different applications has not been discussed. However, the FDA track record is not very good as far as being in a hurry to review and approve any tobacco-related products. Any new cigar blends would have to get approval from the FDA before a manufacturer would be allowed to release them into the market. It is believed that each application will cost around $2,500. In addition, manufacturers will be charged over $1,000 per ingredient and for each vitola separately. Imagine a company with 4 different sizes of a blend containing 4 different tobaccos would be paying over $50,000 in FDA fees, not to mention the fact that the FDA will have no rush to approve these applications. From a consumer standpoint, not only will we be potentially missing out on a lot of the brands we love, but we'll also pay much more for the existing brands still available since these high fees will trickle down into the prices of each cigar. FDA will also ban any and all samples of cigars, including any lounges or cigar events. It is also said that any cigar advertisement will be limited or banned as well. FDA will require health warnings to be placed on the top and front of all cigar boxes, regardless of the cigar's original date of release.
So as you can see, option one is pretty scary. Not only would the manufacturers feel it, all the workers, retail shops, all the way down to all of us, the consumer, would feel the effects of this crazy proposal. Basically, the costs are going to go up. The availability of cigars is going to change dramatically. As you can see, any cigars made after February of 2007 will have to go through applications to get the brands approved, the blends, and everything else. Anything that's new that comes out will have to go through an application process, heavy fees, everywhere from an application fee to paying for every different tobacco in their blend would be charged a separate fee, as well as every different size. For example, if you have a cigar that has 4 or 5 different tobaccos, you're paying for each of those. And then if you have a Robusto, a Toro, a Churchill, Lancero, you're going to be paying for each different size to get approved by the FDA. Not to mention that they don't have the best reputation for being speedy on approving these things, especially on something that they don't like tobacco. So you can imagine how long you'd have to wait for a new blend to come out. And of course, these smaller boutique companies that we all like, they're probably not going to be able to withstand something like that. So you're going to see a lot of changes as far as people going out of business, not having the same selection, and those who do withstand it and are able to stay in the business, we're all going to feel the effects on the prices that we pay for the cigars, the amount of availability, not to mention the different setups and lounges on the lounges that can stay in business. There will be probably little to no cigar events, no free samples, just dramatic changes, including advertisement, the stuff that we look at, the magazines, everything will be changed if this option 1 gets approved. So it's a scary thought. Now, option 2 is a little better. Option 2 would actually exempt, premium cigars from going through all of these restrictions. Now take a look at option 2.
FDA will allow an exemption for premium cigars. However, there is still much discussion as to what defines a premium cigar. Below is what the FDA has proposed as definition. Is wrapped in whole leaf tobacco, contains 100% leaf tobacco binder, contains primarily long filler tobacco, is made by combining manually the wrapper, filler, and binder, has no filler, tip, or non-tobacco mouthpiece and is capped by hand, has a retail price of no less than $10 per cigar, and does not have a characterizing flavor other than tobacco, weighs more than 6 pounds per 1,000 units.
So as you can see, option 2 would be something that we would like to see get approved. All of us in the cigar industry, you and I, the consumer. Option 2 would exclude premium cigars from going through all of these crazy restrictions. So we would feel minimal effects. We're still going to see some effects as far as the health warnings, the availability. They're going to do away with any type of vending machine, the limits on the ages and whatnot. So those things are inevitable either way. However, there's still a lot of discussion as to what defines a premium cigar. Now, you and I know there are plenty of good cigars that are under $10, but FDA has thrown out this price point of tentatively saying anything under $10 would not be considered a premium cigar and therefore would fall into that option 1. So as much as I'm not for putting a price point, because there are, again, a lot of good cigars that are under $10, unfortunately it might be something that's necessary. Now, that being said, it'll still protect us from going through some of these crazy restrictions, and it'll protect the manufacturers to be able to still produce a good product for us, not having to be subject to all of these harsh penalties and application fees and whatnot through the FDA. And it'll make the availability of their cigars, for the most part, close to what it is now. So I really urge you to pay attention to what's going on. Read it for yourself. Don't take my word for it. I've attached plenty of links directly to the FDA, to the CRA website, to my website, everything that has a lot of information about what's going on. Please post your comments. The FDA is asking us, to post comments, and make sure that those comments, again, are not emotional comments, but educational ones. Let them know what we do, what it is that a premium cigar is, who enjoys it. It's not enjoyed by minors, they're enjoyed by adults. It's our right to be able to smoke these cigars. Really, we just need to come together as an industry, as friends, everybody. Get all your family, anybody that you know, whether they're a cigar smoker or not, have them post their comments. Please get together. If you're not a member yet of CRA, I urge you to join as well. That is a group, an organization that supports our rights. Please get on there, read up on it, and if you have any questions, anything I can do to answer for you, please feel free to contact me directly. I'm making myself available. I can't urge you enough to pay attention and really get out there and be proactive. So please post your comments. Again, I can't ask you enough. And thanks for watching, and let's fight the fight together.